Self-Care for Service Providers, presented by Erin M. Carter, LMHC, with Mosaic Family Counseling Center, Incorporated, in collaboration with the Iowa Department of Human Rights. The purpose of this presentation is to support service providers who are doing the difficult work of caring for vulnerable populations during a challenging time by providing information on and practices for self-care. This presentation will cover what it means to make a self-care plan, self-care basics that have a real impact on mental health, such as nutrition, sleep, spending time in nature, and exercise, improving relationships, mental health practices, tools to manage stress and trauma in those we care for, and exercises for mental health practices. Creating a self-care plan. We're going to start by talking about what is self-care. It's something that we hear mentioned a lot, and often when we do, we hear about it in terms of things that sound really indulgent, like going to happy hour, having a piece of cake, retail therapy. Now, those can all be good things. They can even be part of a self-care plan, but also if we're doing those things on a regular basis to try to feel better, they can add stress to our lives instead of taking them away. If we think about so-called retail therapy, going shopping to try to help ourselves feel better, if that's something that we're doing on a regular basis, then that's going to add financial stress to our lives, and it's not going to end up taking care of us. So what self-care isn't is an impulsive indulgence that ultimately adds stress to our lives. What it is a set of actions that improve our functioning by reducing stress, increasing psychological resilience, promoting rest, increasing physical health, things that allow for reflection and creativity, things that improve our supportive relationships and bonding with important others. So we really have to think about what is going to serve you as part of a self-care plan. When we think about creating a self-care plan, it's helpful to consider why we might need one. This presentation is intended for service providers who are caring for vulnerable people during a time of exceptional and unprecedented stress and hardship. Service providers are particularly at risk for something that is known as compassion stress injury. Sometimes it's also known as vicarious trauma or secondary trauma. This is explained in more detail in another presentation called Trauma in the Brain. Those who care for or spend a lot of time with individuals who are under severe stress or who have experienced trauma are at risk of developing some of the same cognitive, emotional, and behavioral symptoms of stress and trauma. To put that into perspective, let's consider why caregiving is so stressful. It's stressful, first of all, because we want to help, and sometimes we can't. We see our clients struggle with financial problems, health and mental health problems, relationship problems. We see them struggle with really difficult circumstances, with injustice, and with abuse. Some of those problems we can address, but some of them are problems that we can't solve, and that can take a toll on us emotionally. Caregiving is also stressful because the problems of others can trigger our own personal stress, our worries, or even our own trauma history. Talking about the worries of others can sometimes make it very difficult to forget about our own. It's also stressful because in our jobs we want to and need to be seen as professionally competent, which sometimes means hiding how affected we are by our own difficulties or the difficulties of our clients. So that's another level of pressure. And finally, caregiving can be stressful because of a special kind of cell in our brains called mirror neurons. Mirror neurons are structures in our brains that allow us to really get on the same page with others. They're really important for bonding, for being able to experience and express empathy. They help us to understand the motivations and intentions of others. From a physical survival standpoint, it's important to be able to understand the motivations and intentions of others, so that tells us that mirror neurons have a big impact on us. It's good, helpful in our jobs, helps us to empathize and provide what people need, but there's a drawback. Mirror neurons cause us to actually experience some of the distress that others are feeling. When our clients experience fear, our brains register that fear. When our clients express grief and frustration, our brains register those emotions as our own. Over time, all of these factors can put us under chronic and overwhelming stress and even trauma. As we think about creating a self-care plan, we're going to look at resilience in several different ways. We'll talk about how nutrition can make us more mentally resilient, practices for better sleep, the impact that being in nature has on reducing stress, and how exercise can help. We'll also talk about some mental habits and practices that can help us with our resilience. Underlying all of these different approaches is the idea of neuroplasticity. Neuroplasticity literally means that our brain is like plastic. It can be formed and molded, changed under the right circumstances. That means that stress and trauma can change our brains for the worse, but it also means that we can change the way our brains work for the better, and that's our goal in making a self-care plan. Let's talk about nutrition. Nutrition often gets overlooked when we think about mental health, but what we eat feeds our brain as well as our body, and it can have a big impact on how well our brains function. We can increase our resilience by eating more of some foods and less of others. First, let's talk about the role of inflammation. Inflammation is a helpful immune response short term. Inflammation is the set of responses that include fever when we have an infection, swelling when we have an injury of some sort, and a stuffed up nose and runny eyes when we suffer from allergies. Each of these inflammatory responses is our body's effort to protect and heal itself, and as a short-term response, it does just that. But when we experience chronic inflammation, inflammation is a way of life instead of a short-term response. It's damaging to our body and to our brains. Chronic inflammation is caused by chronic stress, poor sleep, certain foods, and other factors. Chronic inflammation is associated with anxiety and depression. And in fact, with depression, it has a circular relationship where chronic inflammation leads to depression, and depression seems to lead to an increase in inflammation. Chronic inflammation is also associated with chronic disease such as diabetes, heart disease, and cancer. Now, research shows us that there are foods that fight inflammation and other foods that cause it. The foods that fight inflammation include fish and other kinds of seafood, organ meats such as liver, leafy greens like spinach, kale, collard greens, and other kinds of greens, broccoli, cauliflower, cabbage, peppers of all kinds, fresh herbs, squash, and berries. Those are some of the foods that are best at fighting inflammation. There are other foods that cause inflammation. Sugar and simple carbohydrates, soda and sugar-sweetened beverages, processed meats, fast food or any food that's heavily processed, and also excessive alcohol. Additionally, there are certain nutrients that we need as part of our diet in order for our brains to work at their best. This list isn't a dietary plan, but rather a sampling of research that gives us an idea of what kind of impact different nutrients have on our brain function. Omega-3 fatty acids, such as those found in salmon, kiwi, walnuts, etc., relates to reduced cognitive decline in the elderly, treatment of mood disorders, and improved function after traumatic brain injury. Flavonoids, such as found in cocoa, green tea, citrus fruits, red wine, and dark chocolate, relates to improved cognitive functioning in the elderly. B vitamins are associated with improved memory for women of all ages. Iron, such as found in red meat, fish, beans, lentils, relates to improved cognitive functioning in young women. Curcumin, such as found in the spice turmeric, relates to evidence of improved cognitive functioning in folks who have Alzheimer's and improved functioning after traumatic brain injury. Vitamin D, such as found in fish, mushrooms, etc., relate to preserving cognition in the elderly. Vitamin E, such as found in asparagus, avocado, nuts, and olives, is related to improved cognition after traumatic brain injury and improved cognition in the elderly. The point here is that nutrition is really important for the health of our body and our brain. As was mentioned earlier, when we think about creating a self-care plan, we need to think, what really serves me? This might be a good time to consider nutritional changes that can have a big impact on resilience. Let's talk about sleep. Research on sleep shows that poor sleep is often associated with depression, anxiety, and cognitive changes. Poor sleep quality is associated with a higher risk of substance use disorders. Poor sleep can actually be an early indicator of certain types of mental illness. Frequent wakefulness during the night in young children is associated with delays in learning. Poor sleep is actually associated with Alzheimer's disease, and recent studies indicate that the process that prevents Alzheimer's occurs during sleep. When you sleep, your brain consolidates memory and learning. We can see that sleep is really important for good brain functioning all throughout our lives. Now, there are things that we can do that research shows make it more likely that we'll get good quality sleep, and these practices are called sleep hygiene. First of all, it can be helpful to reserve the bed for two things only: sex and sleep. That means no work, no emails, maybe no TV watching in bed. Now, most of us do at least some of those extracurricular things in bed, and it might be okay for some of us. But if we're having trouble getting to sleep or staying asleep, it might be because our habits are creating an association between our bed and the stress of work, or the irritation we feel when we're scrolling Facebook, or the tension of the TV show we're watching. Those kinds of associations don't help us to sleep well. Sleep hygiene can include limiting the use of screens for an hour or two before bed, and that's because the light used by computers and tablets and phones stimulates our brains. We should limit the use of caffeine and alcohol to earlier in the day. Now, alcohol can often make us feel sleepy, but drinking within several hours before bed is associated with poorer sleep quality and more wakefulness. We should reduce the electronic lights in our bedroom, which can include the power lights from printers or computers or illuminated alarm clocks. I had a client once that was having a very difficult time with waking in the middle of the night and not being able to get back to sleep for hours. Now, everybody wakes in the night, but usually we change position, go back to sleep, and never remember waking at all. So we had to figure out what was stimulating him to full wakefulness and keeping him awake. It turned out that he had an alarm clock that projected the time on the ceiling above his bed, so he would wake, see the time, and then lay in bed watching the minutes tick by and feeling more and more frustrated that he wasn't sleeping. That's not helpful. Next, when struggling to sleep, don't toss and turn for an extended period of time. If you're not sleeping after a reasonable time, 30 or 40 minutes maybe, get up and do something else for a little while and then try again. Again, we don't want to create an association between the place, your bed, and feelings of frustration and anxiety. Next, think about cooperating with your circadian rhythms. Nighttime sleep and daytime sleep are not the same quality for most people. In fact, studies show that people who work overnight generally have shorter lifespans than those who work during the day. Different people are different, and not everybody needs to go to bed at 9 p.m., but it's worth it to notice how bedtime affects the quality of your sleep. If you're having trouble sleeping, shower or bathe before bed, because as your body cools down, it can trigger sleepiness. Studies show that aromatherapy can help your brain to relax, and the scent of lavender in particular is supported by research. Finally, talk to your doctor about persistent sleep problems, because it can be an indicator of other medical problems. Patients complaining of poor sleep often help doctors to diagnose sleep apnea, for instance, a condition in which a patient stops breathing as they sleep. Sleep apnea can contribute to chronic medical problems over time. And also, for those having severe sleep problems, a doctor can prescribe certain medications that can be helpful. So we've talked about nutrition, And we've talked about sleep, but let's think a little bit about how the environment that we're in affects our mental health. Mental health research shows us that spending time in nature actually helps to reduce stress. Studies show that being out in nature helps to improve the feelings that go along with anxiety and depression, helps to reduce irritability, that it reduces both the cognitive and the physical symptoms of stress. Being out in nature reduces negative ruminations. Now, this means getting caught in a thought cycle of negative things, maybe worries or fears or things that we're angry about. It helps us to get out of that cycle and start thinking of more positive things or thinking of solutions. Being out in nature helps to increase our perspective, helps us to have more insight into our problems, other people's problems, helps us to have more creativity. Being out in nature, research shows that it increases pro-social behaviors such as generosity and empathy. And that ultimately, being out in nature increases a sense of connection with the wider world. All right, let's think about exercise. Studies also show that exercise helps to improve mood and is beneficial for cognitive functioning. Exercise helps to reduce the symptoms of depression and anxiety. It provides a physical release for the physical response to stress, which means it can ultimately reduce or help to prevent panic attacks. Exercise is associated with higher levels of neurotransmitters, the amount of neurotransmitter that is available in your brain, including serotonin, dopamine, and norepinephrine. These neurotransmitters are the chemicals that help brain cells to communicate with one another, and they are associated with regulation of mood, being able to feel pleasure, and other important things that are part of our brain's function. Exercise is associated with improved memory and improved executive functioning, especially in the elderly. And exercise is associated with reduced inflammation, and it helps to improve sleep. One thing we know when we think about factors that help us to be resilient in the face of stress and trauma is that supportive relationships with other people, relationships in which we really have a bond, are very important. In the field of sociology, the term social capital refers to the network of people that an individual knows, has a relationship with, shares spaces with, has some sort of culture, whether ethnic or local culture, in common with. Social capital means family, but also friends and coworkers, people you know from church or temple or the mosque, your kids' teachers at school, that sort of thing. Research into social capital shows that having more of it, meaning having a wider and stronger network of relationships in the community, decreases a person's risk of poverty. That's an aspect of the resilience that good relationships offer. There are more people to help. We also know that poor social support, not having those people that offer help and emotional safety, increases a person's risk of developing stress and trauma-related disorders, such as post-traumatic stress disorder, after something bad has happened. Relationships are related to resilience because safety is found in connection and relationships. Physical safety, social safety, economic safety, and psychological safety. Relationships are so important. For some of us then, self-care means giving some thought to how we can either improve our relationships or expand our network of social support. So how can we improve our relationships? First of all, we can think about prioritizing the relationships that nourish us. Which are the relationships that really matter? Which are the relationships that feed us more than they take from us? Those are the relationships that we should give more of our time and energy to. We want to give our important relationships our full attention. We want to give our children our full attention as well. First of all, when the chips are down, most people will agree that their relationships with their children are one of the most important in their lives, but we don't always act like it. Some research shows that in an average American household, parents spend only about 7 minutes a week of really focused time with their child. Our relationships with our children are important for us, the adults, and ultimately those relationships are the ones that most people who have children think of when they think of what's really meaningful in life, when they think of their legacy, when they think of what they wish they could go back and do differently. But those relationships are obviously really important for the children as well. Spending focused time with our kids is protective of their mental health. Their brains need that bonding to develop in the most healthy way possible. When we focus on the important relationships and prioritize bonding, it affects the way our brains work. The limbic system is an area in our brain that's associated with how we experience emotion. When something is off with the limbic system, it causes an increase in negative emotion. And poor limbic system activity is associated with depression and some of the effects of PTSD. But bonding helps produce positive changes in the limbic system. Other thoughts about improving relationships. Some people really need to stop avoiding conflict to improve their relationships. And other people need to learn to let some things go. Some people need to say no more often, which might be part of strengthening boundaries that are too weak. Others need to learn to say yes more often, need to learn to try new things and not always be in control. One thing we can do to improve our relationships is to practice what is called reflective listening. Oftentimes, when we're having a discussion or argument with someone else, instead of listening, we're thinking of our next rebuttal, the next thing we're going to say. Reflective listening is a practice of listening closely enough to be able to summarize or put into your own words what the other person is saying. It might look like listening and then saying, "So, I hear you saying this. Do I have that right?" This helps other people to feel more heard, which, believe it or not, is good for relationships. It also slows down the conversation, which makes it more likely that everyone can stay focused on the topic instead of bouncing around from topic to topic in an unproductive argument. Reflective listening helps us to take more of an attitude of curiosity. We should be more curious about what others are saying, what they're trying to get out. I frequently find that when I'm talking with a client who's upset with the behavior of their spouse or someone else in their life that isn't in the room, and maybe I'm hearing a lot of, "They always do this," that when I ask them what they think the other person is feeling during whatever event we're talking about, they often have no idea. They've never thought about it, and they definitely never asked. Oftentimes, they've assumed something negative, but they don't know if their assumption is accurate. And suddenly, I'll see them get curious. We all want to be understood, and we most want to be understood by the people closest to us. We want to be known. Taking an attitude of curiosity and asking if we've understood correctly is really helpful. Going along with reflective listening and being more curious, it can also be helpful when we're thinking about how other people act to consider what's the best interpretation of this behavior. If I give this person the benefit of the doubt, if I'm assuming that they're doing their best and not trying to hurt me, what's the most generous way of interpreting their actions? Most people are doing the best they can, and they're not trying to hurt the people they love. Now that said, sometimes people are trying to hurt others, and we do need to be careful to recognize abusive behavior and not justify or rationalize it. Finally, it can improve relationships a lot to consider how past experiences have affected the way we are now. Past experiences, good and bad, help us to form our expectations and interpret the behavior of others, and it can affect our own automatic reactions. When there's conflict or avoidance or something that's preventing bonding or preventing effective and mature conflict resolution, we need to think about how we've been affected by things from the past. When we identify problems from the past that are still affecting us today, we can often figure out how to do things differently in a way that leads to better and more satisfying relationships. Okay, so we've talked about some self-care basics. We've talked about improving relationships. Now let's start thinking about some mental health practices that can have a big impact on reducing stress and increasing resiliency. One thing that's really helpful when it comes to managing stressful and potentially traumatic circumstances is to be informed about how stress affects behavior so that we can manage our expectations. For more information on how stress and trauma affects our brains, there's another presentation called Trauma in the Brain that goes into more detail. Stress and trauma create physiological and chemical reactions that cause specific responses in the brain and the body and can limit our options in the moment. Now, there's a reason for this. These fast reactions are intended to help us survive a physically dangerous situation. These reactions prioritize fast and effective action against such a physical threat, think bear in the woods, and they deprioritize analytical thought. The brain causes an automatic fight or flight or freeze response, and that automatic response limits the ability to analyze and to respond logically. So we can help take care of ourselves by being aware of these limitations. When we're in circumstances that are causing us a lot of stress, we can expect our body to respond in certain ways, and we can expect that it might be difficult to think clearly. We should be aware of what triggers those responses for us, and then to have a plan to help manage that response or manage those feelings. When we're in an extremely stressful situation like this, what can be our go-to emergency plan for bringing the temperature down in the situation or down for us emotionally? While we're talking about being aware of how we are affected by stress and trauma and managing our expectations, we need to also acknowledge that everyday life is more sad, scary, upsetting, and overwhelming for some people than for others. And not just because of the biology that we start with or the habits that we have or don't have, but also because of who we are and how our identity relates to events in the world. In this way, self-care might need to include expanding our definition of what causes extreme stress or trauma. Experiencing racism, sexism, or discrimination based on ethnicity, culture, language, sexual orientation, or gender identity, or a combination of these things can be extremely stressful and even traumatic. This is true even if we don't experience the worst of it firsthand. When we repeatedly see others harmed because of their race or their exclusion from a group that's considered acceptable, and we share that race or we share that excluded identity, that's a real stressor that can have a big impact on our mental health. And it's sometimes doubly problematic because it's a stressor that won't be expected or validated or acknowledged by other people in our lives, even people that we share other experiences with and that we're close to. But whether it's acknowledged or not, health and mental health outcomes for Black, Latinx, Asian, and LGBTQ groups show the impact of this kind of stress. Health and mental health outcomes for these groups are poorer. And there are other factors too that go into this, like disparities in healthcare and other things. We all need to acknowledge and accept that these experiences are likely to produce some kind of stress or trauma reaction and build that into our self-care approach. A mental health practice that can have a big impact and yet is so simple we often don't think about it is just taking time to identify our emotions. That sounds simple, too easy, but sometimes it can really be a challenge to slow down and figure out exactly what emotions we're having. I once used this in a college class I was teaching. I asked the class what they were feeling and no one was responding, so I called on one young lady and I said, "What emotions are you having right now?" And she said, happy? Now, this was a night class. It was 8 p.m. and I had just called on her in front of the class, so I don't think she was really feeling happy. Maybe she didn't want to say out loud that she was feeling bored and annoyed. The point is, it can take some work sometimes to identify real, authentic emotions. Being able to verbalize our emotions helps our brains to begin the process of helping us to feel better. Verbalizing also helps our minds to begin to work through responses and to come up with solutions. This is effective if we verbalize them internally. It's more effective if we say them out loud or write them down. At the end of this presentation, I'll lead an exercise where you can practice identifying your emotions. Another mental health practice is to think about how to keep our emotions at their best. And I'll explain that, but first I want to use this quote. John Bowlby, who's the researcher that's most credited with our current understanding of attachment theory, which is about the importance of relationships between children and their parents, once said that clinical conditions can be best understood as a disordered version of a healthy response. So keeping that in mind, let's consider that all of the emotions that we're capable of have purposes that benefit us. In the right context and the right amount, each emotion is helpful to us in some way. So fear helps us to survive threats, as we've talked about. Sadness helps us to adapt to a loss of some sort. Anger energizes us for defensive or offensive action. All of these are useful at some point. However, emotions can also be disordered and can become part of a clinical condition. Emotions can be a problem when they are out of context or out of proportion, or when they're inflexible, or when they negatively impact functioning in social or occupational or other areas of our life. To keep our emotions at their best, we can take some time to consider what is beneficial about our emotional response. What is the good and helpful purpose of this emotion? What good can it lead us to? And even what is there to be grateful for in these emotions? So some examples might be, I'm devastated about the loss of my father, but I can be grateful that we were close enough for me to mourn him. My sadness shows that we had this close relationship, and I can be grateful for that. Or I'm overwhelmed about the needs of my clients, but I wouldn't feel this way if I didn't care a lot, and I'm glad I'm someone who cares, and my clients are better off because I care. We might think, I am so angry about this injustice, but this anger can push me to take action. Those are the positive, the benefits of those emotions, the positive purposes. But we should also consider what's detrimental about this emotional response. Where is it out of context? Where is it out of proportion? Or where is it causing dysfunction? And then we can think about how can we bring it back to its good purpose. Another mental health practice that you might be hearing a lot about these days is mindfulness. Mindfulness has some good research behind it for managing things like anxiety and depression. Mindfulness is a practice of being aware, being present, and noticing things with a non-judgmental attitude. Mindfulness can positively impact problems with mood, as I've mentioned, and over time it can actually change how the brain functions for the better. Some research that came out showed that people who practiced mindfulness for a certain amount of time every day for 40 days made structural changes in their brain that could be measured, so it's effective. This goes back to the idea of neuroplasticity, as we discussed before, the idea that the brain can be changed with experiences both for good and bad. Mindfulness takes practice to develop, and at first it can feel uncomfortable, it can feel hard, and like you can't manage to do it right. The important thing isn't to do it right, but to do it consistently. Changes take place over time. Mindfulness has many forms. Things like prayer and meditation and yoga all have an aspect of mindfulness, though they might have different spiritual goals. Practices like identifying emotions also has an element of mindfulness. Mindfulness can be very simple, and it can be practiced wherever and whenever. So let's think again about what mindfulness is. I said it's being present, being aware, and noticing things with a non-judgmental attitude. It involves awareness of what's happening in the present moment, which is different than being caught up in our thoughts about what happened yesterday or what's happening tomorrow. Mindfulness involves acknowledgement of those things that are happening. First, we have to be aware of them, and then we have to acknowledge them. Acceptance refers to the fact that we don't have to do anything. We just notice things and accept them for what they are. When we're being mindful, we're not judging our thoughts or our experiences. We're being curious and we're noticing. Mindfulness involves focusing our attention on something specific and engaging with the experience, and when our minds wander, we bring it back to that focus and engagement. Beginner's mind refers to the curiosity that I mentioned before, trying to notice and see things as if for the very first time, not taking things for granted, not assuming. Finally, mindfulness involves patience and trust. As I mentioned, it often doesn't feel easy or comfortable at first. Mindfulness practice can feel boring or irritating or frustrating, but we approach it with patience, trusting that over time it will pay off. There will be some mindfulness practice at the end of this presentation. Another practice that can be really helpful for reducing stress and increasing resilience is something that we call tapping in. Tapping in is a form of the bilateral stimulation used in EMDR therapy, for those who might have heard of that. EMDR is a therapy most associated with the treatment of the effects of trauma. Tapping in helps the brain to strengthen positive feelings and positive imagery, and you can use it anytime you want to bring something good to the surface for you emotionally. It increases the availability of psychological resources, makes helpful psychological functions more accessible, more ready to be used. Tapping in promotes state change, which is another way of saying changing how you feel, getting you out of a really intense, stuck emotional state into an emotional state that's easier, feels better, and gives you more options. Tapping in involves slow tapping that alternates from one side of the body to the other. This can be done by having hands on your knees, where the right hand taps, then the left hand taps, then right, then left, tap, 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 tap. Another way that some people like to do tapping in is by using what's called a butterfly hug. To do this, you cross your arms over your chest like you're giving yourself a hug with hands on opposite shoulders. Left hand taps, right hand taps, tap, tap. You can also tap by moving your feet in an up and down walking motion or by actually walking. You can tap in using your fingers. I've taught tapping into a client who wanted to use it to help herself avoid panic attacks at work, and she wanted to be low profile about it. So she used her fingers instead of her hands to tap, and she felt confident that no one noticed what she was doing. At the end of this presentation, there will be several tapping in exercises to give you an idea of how to use it. Another practice that is so simple we often don't think of it is taking a break. We have to learn how to take a break, especially in our current environment of 24/7 news. We really need to think through how it might be possible to reduce our exposure to stressful events. When we think about making a plan for taking a break, we should think about limiting our involvement with social media for a time, and we need to think about stepping back from the news for a while. It's okay and it's important to step away sometimes. Many of us find a lot of our purpose and satisfaction in serving others, especially serving vulnerable populations whose needs are overwhelming and ongoing. But we also know that if we don't take a break now and then, we eventually won't be able to serve at full capacity. Consider if there are things that you haven't allowed yourself to do lately. Sometimes it doesn't seem okay to laugh. Have you not allowed yourself to watch a movie or to listen to music or to take a walk? A self-care plan needs to include time for rest that's restful. Early on in this presentation, I mentioned that a self-care plan really needs to consider what serves you. Of the things that we talked about, what do you need to do in order to be more resilient? And what's really going to work for you? This would be a good time to stop this presentation or maybe come back to this later and write down a plan. Think about what we've discussed related to nutrition, exercise, sleep, spending time in nature, improving relationships, mental health practices, and rest. Don't try to change everything at once, but do try to be specific about some actionable steps that you can start to take. In addition to the steps we've already talked about, good professional tools can be part of a strategy of reducing stress when working with vulnerable populations. One thing we can do is to get a better understanding of how stress and trauma affect the brain and the body, and you can look for another presentation that goes in detail on this topic called Trauma and the Brain. Let's talk about resilience factors. This can be very helpful information to have when working with a population that has a high incidence of stress and trauma. Let's start with this fact. Not everybody who experiences stress and trauma develops a trauma disorder. There are factors that make it more and less likely that someone will be impacted by trauma in a way that causes severe and chronic impairment. One key factor that makes development of a trauma disorder less likely includes good social support. So when providing services to vulnerable populations, helping them to build up their network of supportive relationships means a lot. Going along with that, giving those you provide services to space to talk about their stress or trauma is a real service. People who have experienced trauma often find that those around them have no patience or tolerance for hearing about it, or are determined to make them feel better with an insistence that invalidates the difficulty of their experience. Giving clients with trauma the time and the space to talk without judgment, and maybe without trying to talk them into feeling better, conveys the message that what has happened to them isn't so terrible that it can't be listened to, and that they can still connect with others. On the flip side, we should never pressure those who aren't ready to talk about their trauma to do so. Trauma is damaging in part because it takes power away. Giving people the space to decide when and how they're going to tell their story is a step toward restoring that power back to them. People who've experienced trauma are less likely to develop trauma symptoms when they can understand their responses as normal and when they can see their own actions in a positive light. In this way, understanding how trauma affects the brain is a tool because it gives us a way to communicate to our clients that what they're experiencing is normal and helps them to understand it. Helping clients to reframe their actions during the trauma in positive ways is another tool that can be very effective. People who have experienced trauma often feel a lot of shame and guilt. Being able to reframe their actions as those of a survivor, someone who did what they had to in order to make it through, and someone who is brave enough to try to put their life back together now is powerful. People who have experienced trauma are less likely to develop trauma symptoms when they can act effectively in spite of their fear and when they have good coping skills. So working with those you serve to improve those areas is very helpful. Now, good professional boundaries are another way for us as service providers to take care of ourselves. Boundaries based on ethics protect us as well as protecting our clients. Ethical boundaries help me as a therapist to offer what I can and not be overwhelmed by the problems of my clients or feel that I'm responsible for making everything in their lives better. Ethical boundaries also help me to know that I'm not abusing the relationship I have with clients. Knowing our ethical boundaries and following them closely is another form of self-care. Additionally, some of us need to be aware of setting boundaries that protect our physical safety with our clients. We should always have a plan for keeping ourselves safe and getting out of a difficult situation should it arise. Finally, having professional support is very important. Sometimes we all need consultation, new ideas, a sounding board, or someone to help us think through what we should do. Sometimes we all need someone to vent to who understands what this work is like and who can encourage us to be our best. Being purposeful about developing and utilizing this professional support is another form of self-care. Next, I'll lead you through some practices to improve mental health that we've discussed so that you can see how it can be done and maybe start to incorporate some of these practices into your day. So first, I'll lead you through an exercise of putting your emotions into words, verbalizing your emotions. Now remember that verbalizing emotions helps us to begin to adapt to them, helps us to make meaning of them, and helps us to find solutions to the problems that they represent. So you'll want to start in a comfortable, quiet, private place with some paper or journal, something to write with. First, you want to start by quieting your mind by taking a few deep breaths. And really notice what it feels like to breathe. So as you breathe in and air moves through your nose, you can feel it go into your lungs. Notice what that feels like. And then when you reach the end of that breath and you push it out, notice what it feels like leaving your body. Notice the temperature of your breath. Notice how it makes you feel to fill your body with oxygen and to push your breath out. Noticing your breath can help you to get quiet and really notice what's going on inside of you. Now consider the emotions that you're having, not the emotions that you think you should have, but what you're really feeling. And when you can identify them, write them down. But sometimes it takes time to be able to really identify these feelings. If you're having a hard time putting a name to your emotions, start by writing down a list of all of the emotions you can think of, even if you're not feeling them. So go beyond angry, sad, happy. Think frustrated, content, lonely, satisfied, bored, disappointed, gratified, or numb. When you have a list, it's something that you can refer back to if you can't quite put your finger on the right word for what you're feeling. It's okay to try out an emotion and then later change your mind. So for example, I feel frustrated. Well, no, wait, actually, now that I think about it, I feel disappointed. And when you have a list of the emotions that you're actually feeling right now, and it might just be one, it might be one or two, depends on what's going on. But next, write down what physical feelings you have that accompany those emotions. You have to really pay attention to your body with this. Do you have a headache? Is there pressure in your chest? Tingling in your fingertips? Pay attention to any tension, any pain, any fatigue, or any numbness. Write down those physical feelings. Next, for each emotion, answer the question, what does it mean that I feel whatever it is right now? So for example, what does it mean that I feel scared when I see an email from my boss? What does it mean that I feel annoyed when my spouse asks about my day? See if you can figure it out. And if you can, write it down. So we've named the emotion. We've noticed the physical sensations that go with it. And we've given a little bit of thought to the meaning of that emotion. Now, this doesn't solve all of our problems, but it does give us a better grasp on what's happening and gives us a better idea of what steps we might need to take to resolve it. Now we'll do a short exercise that incorporates some mindfulness. Now actually identifying your emotions is also a type of mindfulness, but with this exercise we're going to spend more time noticing our breath. So once again, find a comfortable, private, quiet place where you can be alone for maybe 5 or 10 minutes. And first you can either close your eyes or just soften your gaze, do whatever feels comfortable, and start to pay attention to your breath. You breathe in and you breathe out. What do you notice about it? What does it feel like to breathe in? Where can you feel it in your body? What does it feel like to breathe out? What does it sound like when you breathe in? What does it sound like when it goes out of you? When you breathe in, where can you feel it going in your body? And if you could imagine where else it goes, where else do you imagine it goes? Can you see it going all the way to your fingertips, the ends of your toes? Does it get stuck somewhere? You can also think about if your breath was a temperature, what temperature would it be? If it was a color, what color would it be? If your breath was a shape inside of you, or a shape once you blow it out, what shape would it take? And while you're doing this, other thoughts may come, thoughts that are not about your breath, and that's okay. It's normal. When those thoughts come, you can acknowledge them. You can accept them. Okay, I see that thought. It's there. That's fine. But then once you see what's happening, refocus on your breath. Come back to it. Another way to increase the experience of noticing your breath is to use some aromatherapy, which was mentioned earlier in the presentation. We talked about using lavender specifically for sleep. You can use a little bit of, some kind of scent like that, and as you're breathing, think about what color would that scent be? What are the emotions that go with that scent? Okay. Another way to practice mindfulness is to think about setting your intention. Now, if you do yoga, you probably have heard these words before, set your intention. This is something that you can do at the beginning of the day or anytime during. You can take a few minutes to decide what's your goal with this time that you have. What are you hoping will happen, or what are you hoping to sort of live into, right? You can set your intention or intentions for the day. You can set your intention for the next 20 minutes. Setting intentions are a way to help you make sure that you're living your values and prioritizing what you care about. So some intentions that you could think about would be, today I'm going to show love to others. Or for the next half hour, I will really notice my child. Or when I talk to this client, I'll enjoy the work that I do. So right now, starting by noticing your breath is always a good way to kind of quiet your mind. Take a minute, notice your breath. Notice what it feels like coming in. Notice what it feels like going out. And let yourself get quiet. And then take a few minutes to really reflect on what's important to you. And set your intention. It's often a good idea to write down your intention. That really helps solidify it in your brain. Okay. Now, we can also practice mindfulness while we do just simple chores around the house. Remember, we talked about how mindfulness is something that you can do anywhere and at any time. So while you do a normal, everyday task, be present and notice everything about it. Remember, one of the aspects of mindfulness that we talked about was beginner's mind, right? So as you're doing this, notice it, notice the process as though it is the very first time that you're doing it and you are awake to all of the sensations that come with it. So let's talk through practicing mindfulness while we wash dishes. While you wash dishes, you might notice the heat of the water and how it feels on your skin. Does it tingle? Does it hurt? We can pay attention to the scent of the soap, what the bubbles look like. We might notice how the sponge wipes the dirt away, and what does that make us feel? Does that feel satisfying? Does it feel like something else? As we wash dishes, we can notice the water in all of its forms. There might be droplets. There might be water in the bottom of the sink. There might be steam. Other thoughts might come. We can acknowledge and accept them, and then let them pass and refocus on the task. Remember that with all of these mindfulness exercises, mindfulness can be very simple and it doesn't take very long. It doesn't have to take very long. But doing it consistently, doing it, daily over time really can have a big impact on the way that our brains function. Okay, now I'll lead you through a tapping in exercise, and we will be tapping in a comfortable place. So if a safe and comfortable place in your mind would be a good resource to have at hand, you can use your imagination and bilateral stimulation to make one more accessible. So first we're going to, again, find that comfortable, private, quiet place to be undisturbed for a few minutes. Now we've talked about how tapping can work. This can work with your hands on your knees where you would use left hand, right hand, left hand, right hand, tap, 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 right? Alternating across your body. This can be a butterfly hug where you cross your arms over your chest with each hand on the opposite shoulder and tap with one hand, tap with the other hand, tap, tap, tap. You can move your feet up and down in a walking motion, or you can even do this while walking. Okay. So first we're going to start by noticing our breath. Breathe in. Notice what it feels like. Breathe out. Notice what it feels like. Breathe in again, and our minds are quieting. We can imagine more easily. And as we breathe out, try to make that breath out a little bit longer than the breath in. Now I want you to use your imagination to create a comfortable place. And this can be a place inside or outside. It can be a place you know or a place that you've never seen. I want you to imagine what it looks like. You can create more than one comfortable place. So if you can't decide, then just pick something for now. You can go back and do this again and do something else next time. So imagine what this comfortable place looks like. See the details. Imagine what it feels like. Imagine colors and smells. When you have it in your mind, hold it there in your mind, and then I want you to tap, 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 tap. Now I want you to think about what you would call this place. Would it have a name? Something general, something specific? If you find a name for it, then I want you to tap that in. Tap, 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 tap. I want you to think about what feels good about being there. When you have that in your mind, I want you to tap it in. Tap, 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 tap. Now take a deep breath in and then out. Now this comfortable place is available for you whenever you need it. And if it felt good to do this tapping, if it felt good to imagine it and to do the tapping, go on for as long as you want. And it's always there whenever you want to use it again. Okay, now we'll use tapping in to create a strong container. So we can use bilateral stimulation, the tapping in, right, to create a mental container for the emotions, problems, concerns that need to be stored until you're ready to solve them. So first, find a comfortable, private, quiet place to be undisturbed for a few minutes. Remember that you can do tapping by placing your hands on your knees and alternating tap, tap, tap. You can do the butterfly hug where your arms are crossed in front of you, hands on opposite shoulders, tap, tap. Or you can use your feet to walk them up and down and tap that way. Now start by noticing your breath. What it feels like as it comes in, what it feels like as it goes out. Good, clean air coming in, air going out. Now I want you to use your imagination to create a strong container. This is a container that can hold any of the emotions or problems that you have that you're not ready to deal with right now. So it needs to be the right size. It needs to be big enough to hold these things, but maybe not too big. And it needs to be secure. It needs to be a place where you can put things in and take them out. And when you put them in, you know that they're going to stay. And it needs to be comfortable so that the things that you put in there, the problems that you put in there, so that they're willing to stay, that they're happy staying there. So I want you to imagine what this container looks like. When you have something in your mind, tap it in. Tap, 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 tap. I want you to think about, what would you call this container? Is it the container? Is it the box? Does it have a more of a specific name? When you've decided on something, I want you to tap it in. Tap, 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 tap. Now I want you to imagine a small problem, something that's not too big and too hard. Small problem that you'd like to store in this container. I want you to imagine taking that problem and you place it inside the container. And then you close it up. Maybe you lock it. I want you to think about, how does it feel to have that problem stored in a secure and organized place in your mind? Think about, what are the pleasant emotions that come up because that problem is contained? And then I want you to tap that in. Tap, 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 tap. Take a deep breath in and then out. And know that this container is available for you whenever you want to use it. Here is a list of references I used in the making of this presentation. Much of the information comes from my clinical practice, which I hope you've benefited from. We have covered creating a self-care plan, self-care basics, including nutrition, sleep, being in nature and exercise, improving relationships, mental health practices for self-care, tools to manage stress and trauma in those we care for, and some exercises for mental health practices. I hope this has helped to offer some new ideas and information about why we need self-care and effective steps we can take. And I hope that you will all make a self-care plan. Thank you for listening to this presentation.